My name is Sarah Hines from the RAND Corporation, a nonprofit research organization that's helped CMS design and implement the Ground Ambulance Data Collection System, or GADCS. I'll be presenting today along with my RAND colleague, Dr. Lisa Sontag-Padilla. Before we get started, I'd like to remind everyone that today's slides and a printable version of the GADCS questions, which we call the instrument, are available on the CMS Ambulance Services Center website. It may be helpful to have the instrument at hand to follow along today or for reference later. This is an update of an earlier CMS presentation on volunteer organization requirements that includes finalized changes in GADCS instructions, questions, and systems since the prior webinar in 2021. The session today will cover data collection and reporting requirements for organizations using volunteers. The presentation will cover every question specific to organizations with volunteer labor. Specifically, we will cover questions from GADCS Section 2 on organizational characteristics, Section 7 on labor costs, and Section 11 on other costs. This slide presents some resources where you can get more information on the GADCS, including printable versions of the GADCS website in English and Spanish, the user guide, which walks you through how to use the online GADCS portal where you will report your information, a periodically updated frequently asked questions document, a quick reference guide, tip sheets on various GADCS topics, and a full video walkthrough of the GADCS. Those are all available on CMS's GADCS website, which is the URL in the top blue box. Note that this presentation uses screenshots from the online GADCS portal where you will actually report your information. The portal has the same questions that you will see in the printable GADCS instrument, though some questions may not be shown or look different depending on your answers to prior questions. We will highlight ways that specific questions might look different for different organizations as we go through the presentation. Finally, if you want to learn more about other sections of the GADCS or about topics that we aren't covering today, there are several other past webinars you can view on the CMS Ambulance Events website, which is listed in that bottom blue box. Webinars are available on topics such as requirements for fire or other public safety organizations, reporting labor costs, and reporting revenue. Now we'll get into the questions in the GADCS that are especially relevant for volunteer organizations. Section 2 on organizational characteristics presents a number of questions to learn more about your ambulance organization's characteristics. For example, are you hospital-based or is your organization fire department-based? Do you respond to emergency calls for service? Beyond giving CMS a better understanding of your organization, these questions are important because they will determine which questions and instructions you see later on. Most relevant to this presentation, Question 6 in Section 2 asks if your organization uses volunteer labor. When deciding whether or not to report that your organization uses volunteers for the purposes of this instrument, here are some things to consider. Volunteers who receive stipends, honoraria, or other types of monetary benefits are still considered volunteers. Do not include staff who are paid on an hourly or salary basis, even if they perform some activities. For instance, responding as an EMT on a volunteer basis. Additionally, volunteers who change to paid staff at any point during the data collection period do not count as volunteers for the purposes of reporting. Volunteers who support only ground ambulance duties, for example, fire or police duties, should not be counted anywhere in this instrument. Finally, staff who are volunteer at another organization but are paid at yours do not count as volunteers for the purposes of reporting. If you indicate in Section 2, Question 6, that your organization does use volunteers, you will get additional questions about volunteers in Section 7, which asks about labor costs. I want to mention that there are a number of other sections that we are skipping over for the purposes of this presentation. Sections 3 through 6 ask about service area, emergency response time, service volume, and service mix, and are relevant for all organizations completing the instrument. Because these sections are identical for organizations with and without volunteer labor, we do not focus on these further today. As a reminder, the questions about ground ambulance services in these sections apply to all ground ambulance services provided by your organization, not just the ones paid for by Medicare, unless otherwise specified. Now we begin our discussion around reporting labor, including staffing and any expenses associated with volunteer staff. Before we dive into the details of this section, I want to take a moment to acknowledge that ground ambulance organizations represent a very diverse group of organizations with a wide array of staffing needs and structures. Volunteer staff are vital to the operations and sustainability of many of these organizations. Capturing information about time spent on ground ambulance operations, as well as costs associated with supporting volunteer staff, such as stipends, honoraria, or benefits, is crucial to accurately estimating the cost of ground ambulance operations. While some ground ambulance organizations utilize only paid staff, many others use a mix of volunteer and paid staff, and some rely on volunteer staff exclusively. On this slide, we review the types of information you will be required to report for volunteer labor. For each labor category, you will need to report number of individual volunteers, total hours worked by volunteers related to ground ambulance operations, and if your organization shares services with fire, police, or other public safety operations, you will also report total hours worked related to fire, police, public safety operations. All organizations will also need to report total hours worked related to all other responsibilities that is not related to ground ambulance or public safety operations. You must also report total compensation of any type to volunteers, including stipends, allowances, benefits, and any other type of monetary compensation. You will not, however, collect or report any imputed valuation of volunteer labor, meaning you will report hours worked and any actual expenses, but nothing along the lines of what wages would have been if they were paid. This slide provides a high-level overview of Section 7 on labor costs. The overall goal of Section 7 is to capture information on your organization's staffing and costs associated with ground ambulance labor. Although this section is relevant for all organizations, we won't go into any details for reporting on paid staff. Broadly, this section of the GADCS is broken up into two steps. The first step is reporting which types of staff are used by your organization. We'll review the instructions on how to do this in the next few slides. The second step involves reporting information on number of volunteers, hours worked, and costs for your staff in each category. Now, I'll turn it over to Lisa to discuss the questions in Section 7.
Thanks, Sarah. Now moving on to the questions in Section 7. Section 7, Question 1 asks you to report whether your organization has staff in different EMT response categories using a set of checkboxes like this. Labor categories are represented in each row. The two columns are meant to capture whether you have paid or volunteer staff in each category. Note that instead of reporting a count of how many staff members fall into each category, you will simply check off whether you have any staff members for each. If your organization uses volunteer labor and the volunteer column does not appear in the table, go back to Section 2, Question 6, and verify that you have correctly marked yes to having volunteers. There are some minor differences in how this table will appear for fire, police, or other public safety-based volunteer organizations. Namely, you will see 4 total columns instead of 2 that ask if you have paid or volunteer staff with and without public safety responsibilities. This slide covers the rest of Section 7, Question 1, and asks the same questions, this time about administrative and facilities staff. Next, we will discuss how to categorize volunteer staff and staff in general. It's important that each staff member is assigned to just one labor category for the purposes of reporting throughout Section 7, even if they perform multiple roles within your organization. This is important as it minimizes the chances of double counting staff and eliminates the need to split hours and compensation for a single person across multiple staff categories. This slide distills the most important instructions on staff assignment into a flow chart. Here, we focus exclusively on decisions that affect whether you'll categorize staff into one of the volunteer labor categories. The instructions can be simplified into 4 main questions. First, Does the staff member have ground ambulance responsibilities at your organization? If no, do not include them in reporting. Second, were they paid or volunteer staff at your organization? Third, did they have an EMT response role at your organization? Finally, which specific EMT response or administrative facilities category do they belong to? Answering these 4 questions for each of your staff members will tell you, in most cases, how they should be categorized for the purposes of reporting. Now we will walk through some of the rules for determining how to categorize staff into one of the labor categories. First, volunteers who get a stipend or other modest amounts of compensation or benefits, but are still considered volunteers per state and federal labor laws, should be reported as volunteers. Staff who volunteer at other organizations but are paid at your organization should not be counted as volunteers. Volunteers who had only non-ground ambulance responsibilities, for example, volunteer firefighters who did not respond to EMS calls, should not be reported anywhere in the JADCS. Include volunteer EMT response staff in the EMT response category that matched their level at the start of the data collection period. For administrative facilities staff with multiple roles, assign each volunteer to a category indicating their primary activity. Finally, anyone who is paid as a salaried, hourly, or contracted employee at some point during the data collection period should not be counted as a volunteer, but as paid staff instead. On this slide, we provide some examples of how to think about categorizing different types of volunteer staff that have multiple responsibilities. Let's first consider a volunteer administrator handling billing and clerical duties and occasional vehicle maintenance. Based on the rules, this person would be categorized in the volunteer administration facilities category based on their primary responsibility. Next, let's consider a volunteer EMT intermediate, also known as an EMT advanced, who became a volunteer EMT paramedic during the data collection period. This person would be categorized as a volunteer EMT intermediate based on their position at the start of the data collection period. Next, we will have a volunteer EMT basic who became a paid EMT basic during the data collection period. Remember, you always include staff who had both paid and volunteer duties in the appropriate paid category. So in this case, you would categorize this person as a paid EMT basic. Next, consider a volunteer EMT basic who also performs some clerical work. This person would count as a volunteer EMT basic because staff with any EMT response duties are always categorized in the appropriate EMT response category. Finally, consider a volunteer EMT basic with only air ambulance responsibilities. This person would not be reported because they do not have any ground ambulance duties. This slide shows section 7, question 2, which asks if you contract a medical director rather than employ one directly, as is common for many smaller organizations. If you have answered yes here, you will be asked to report their compensation for the data collection period. Keep in mind that you will not see this question if you report having a volunteer or paid medical director. Most organizations will have staff in some, but not all, of the categories listed in the table in question 1. For each labor category that you report not using in the table in question 1, you'll be asked to provide the reasons why you reported no in both the paid and volunteer columns. There are a few common reasons listed in the question itself, including the labor category is part of your ground ambulance operation, but is paid for or provided at no cost by another entity. One or more of your staff perform these functions, but these staff were assigned to other categories per the instructions. This applies to administration or facilities roles that are performed by someone with EMT or response responsibilities. You do not have staff in this labor category related to your ground ambulance operation, or you contract with another organization for this role. Keep in mind, if you contract with another organization for this role, you will need to report those costs in section 11 on other costs. Finally, if none of these apply, you can enter your own reason. Note that you're able to check multiple reasons per category. The next two sections, section 7.1 and 7.2, are paid labor. So we will not discuss them during this particular call. However, we recognize that many organizations will have both volunteer and paid labor. As we mentioned previously, volunteers who are paid staff at any point during the data collection period should be counted as paid staff. As such, their hours and compensation, including any stipends and benefits they received as volunteers, should be reported under paid staff in section 7.1 and 7.2. For a detailed overview of how to complete these sections for paid staff, refer to a separate webinar on section 7 labor costs on the ambulance events website. The address for that is at the bottom of this slide. Now we turn to section 7.3 on volunteer labor. In this section, you'll need to report the number of individuals who were volunteers during the data collection period. You will report them by labor category according to the rules presented earlier in the presentation. You will also report on hours worked by volunteers by labor category. Finally, on total costs associated with volunteers, including costs like stipends, allowances, or honoraria, I'll turn it back over to Sarah, who will walk us through the questions in section 7.3.
Thanks, Lisa. Now on to section 7.3, starting with question 1, number of EMT response volunteers. In this question, you will report on the number of individuals who are EMT or response volunteers during the entire data collection period, regardless of the number of hours they work annually. As a reminder, do not include an individual in section 7.3 if they did not contribute at all to ground ambulance operations or were a paid employee at any point during the reporting period. If a volunteer EMT became a paid EMT during the reporting period, report them in section 7.1, not here. On the next slide, we have a brief example of how to count volunteers. In this example, the organization has 12 staff members who would be classified as volunteer during the data collection period. 7 volunteers who only have EMT duties and 3 volunteers who have EMT and administrative duties. They have 2 volunteers performing only administrative duties, so they wouldn't be counted as EMT response volunteers. They also have 1 volunteer EMT response staff who became a paid employee in the last month of the data collection period. So they don't count as volunteer for the purposes of reporting to GADCS. This organization would answer 10 for the number of EMT response volunteers because they have a total of 10, 7 plus 3, volunteers who performed any EMT duties. On to section 7.3, question 2. In this question, for each category of EMT staff, you will be asked to report hours worked annually related to ground ambulance operations and, if applicable, hours worked annually related to fire, police, and other public safety duties. And finally, total hours were worked related to all other responsibilities. For all responses, do not include time on call or time spent fundraising. As you can see, the column labeled total hours for all EMT response staff is grayed out. That is because you don't input those values directly. Rather, they are automatically calculated from the values input to the right and should be used as a check. We list the specific activities that are included in each column for question 2. In the column on total hours worked, you will include all duties, including ground ambulance activities, fire, police, or other public safety duties, as well as other types of duties unrelated to response duties. These hours worked related to all other responsibilities include activities like air ambulance operations, healthcare delivery unrelated to ground ambulance, such as work in the clinic, public health responsibilities, community education and outreach, community paramedicine, any other responsibility unrelated to ground ambulance activities, fire, police, or other public safety duties, excluding fundraising and time on call, which is not included anywhere in the instrument. Now we present an example of how to answer section 7.3, question 2. In this example, the organization has 2 volunteer EMTs at the basic level. The first worked 500 hours during the data collection period responding to ground ambulance calls, 20 hours on public health outreach, and 10 hours fundraising. The second volunteer spent 200 hours responding to ground ambulance calls. For hours worked annually related to ground ambulance duties, you would add together all hours spent exclusively on ground ambulance duties, which in this case would be 500 plus 200, totaling 700 hours. Finally, you would report 20 hours for hours related to all other responsibilities. Note that the 10 hours fundraising does not get included in the hours worked annually for any of these categories. Section 7.3, question 3 asks you to report the number of individuals who were administration or facility volunteers. As for all questions in this instrument, do not include individuals in this section if they did not contribute to ground ambulance operations, if they were paid at any point during the collection period, or if they had any EMT or response duties. Here we report on labor hours for administration or facility volunteers in question 4. You will only see this question if you previously indicated that your organization had volunteers in this role. Please note that all of the administration or facility roles that you indicated you had in section 7, question 1 are combined into a single administration facilities role for this question. As in the previous questions, for each staff category, you will report total number of hours worked related to ground ambulance operations. If you have fire, police, or other public safety operations, you'll be asked to report total number of hours related to fire, police, or other public safety activities, and total number of hours related to all other responsibilities for administration facilities. Note that if you reported previously that your medical director was a volunteer staff, you will report their labor hours in question 5 of section 7.3. Specifically, you will report total numbers of hours worked annually at your organization, total number of hours related to ground ambulance activities, and total hours related to all other activities. Organizations that did not report having a volunteer medical director will not see this question. Section 7.3, question 6, will have you report costs associated with volunteers. Even though volunteers aren't paid a salary, CMS heard from organizations that volunteers are sometimes provided nominal financial benefits, and in some cases, state law allows volunteers to receive health or retirement benefits. In this question, you can report these costs, including stipends, honoraria, or benefits such as health insurance and other compensation for ground ambulance volunteer labor. Do not include estimated market value of the labor, only costs actually incurred by your organization. If costs, for example, benefits or stipends, are paid for by other entities, for example, your local municipality, you must collect and include the dollar amount in your response to this item. If staff were considered paid staff at any point during data collection, report any stipends or benefits received while they were a volunteer, along with their salary in section 7.2 for paid staff compensation, not here. Before we dive into section 11 on other costs, I want to mention that there are a few sections that we're skipping over for the purposes of this presentation. These sections 8 through 10 ask about facilities costs, vehicles costs, and equipment, consumables, and supplies costs. The questions in these sections are identical for organizations with and without volunteer labor, so we will not be discussing these sections on today's call. Here we discuss section 11, other costs. In this section, you can report all other costs related to ground ambulance operations. A general rule is to make sure that you report all of your organization's costs and you don't report any costs in multiple places. Most costs associated with volunteers will be reported in section 7 on labor costs, but you may report a few other expenses in this section that are related to volunteers. This screenshot shows a few examples of categories of other costs in section 11, question 4 that might be relevant to volunteer organizations. For example, any costs for training volunteers that were not already reported in the labor section can be reported here. For example, if in-house staff did the training and you reported their compensation in section 7, report those training costs here. However, if you hired an outside organization or paid for volunteers to go to a training class, those costs should be reported here. Similarly, costs related to conducting physicals or medical assessments can be listed here if those costs weren't already accounted for in the labor section. Now that we've walked through all the relevant sections of the instrument, we will give a summary of requirements for volunteer organizations. First, and this is true of both paid and volunteers, staff do not count any employee twice across the various staffing categories. More specifically, an employee should not be counted as both paid and volunteer. If an employee transitioned from volunteer to paid, count them as paid and count all of their hours worked and compensation for the data collection period in the relevant paid category. If a volunteer receives benefits or a nominal stipend, they still be considered a volunteer, and associated hours worked and costs will be reported in the volunteer section. Report all costs associated with volunteers only one section following the instructions. Do not double count costs such as uniforms for volunteers in multiple sections of the instrument. Continuing on with our summary, collect and report the specific hours worked across volunteers within each staffing category. We are aware that some organizations may not track volunteer hours. For example, they may just track the number of responses or runs and completed training tasks. However, there will not be an alternative approach to reporting hours, and your organization may need to begin tracking volunteer hours if this is not something you currently do. I'll turn the presentation back over to Lisa, who will go through a step-by-step illustration of how a hypothetical ambulance organizations with volunteers might answer the questions in the labor section.
Thank you, Sarah. Taking what we've discussed, we will now walk through a complete illustrative example. Before we dive into this example, I want to emphasize that all answers are hypothetical and are not intended to provide benchmarks for typical costs or other responses. Instead, the goal of this example is to illustrate the process of filling out this section of the survey. I also want to note that this organization might be less complex than your organization. You can view past webinars and other resources, for example, tip sheets for public safety and provider organizations at the GADCS website. Now let's provide some background on this hypothetical organization. It is a government EMS organization with no fire or public safety services. It primarily serves a small city and provides around 2,000 transports each year. The organization provides mostly emergency transports from a variety of payers, and they have a mix of paid and volunteer staff. Before we get into how this organization would answer questions in Section 7 on labor, I want to give you an overview of their labor structure. The organization has 13 EMTs in total. 8 EMT basics are part-time volunteers, and 5 EMT paramedics are full-time paid staff. All of the EMTs and paramedics respond to emergency calls, transport patients, and occasionally do public health outreach. One of the volunteer EMT basics occasionally performs basic vehicle maintenance. The organization also has 2 administrative staff members who are part-time volunteers. The administrator and medical director are both paid staff. This ground ambulance organization also contracts with other organizations for several types of services, which include facilities, maintenance, and cleaning, advanced vehicle maintenance, and dispatch. Costs and labor hours for contracted services should not be included in Section 7. Contracted services instead will be reported in Section 11 on other costs. Now let's walk through how this organization would report information in Section 7. The organization would check yes in the volunteer column for the EMT basics and volunteer administrative facilities staff. For the paid column, this organization would check yes for the EMT paramedic and medical director rows. As a reminder, each employee should only be counted once in one role throughout the labor section, and employees with any EMT or response roles should be categorized in the relevant EMT response category. So the volunteer EMT who does basic vehicle maintenance is categorized here and not as a vehicle maintenance staff. This organization does not have several categories of staff, such as EMT intermediates, so nothing in this row is checked off. This organization will not be shown the additional options for staff with fire or police responsibilities because the organization indicated in earlier sections of the instrument that they did not have these roles. This slide shows the rest of Section 7, Question 1. The organization notes that they have volunteer administrative staff and a paid manager. Other boxes are left unchecked because they contract with another organization for these services rather than directly employ these staff. This slide starts the section on volunteer labor, Section 7.3. If your organization does not use volunteer labor, you would not see this section in the programmed instrument. Question 1 asks for the number of EMT response volunteers, and this organization reports 8. For question 2, you need to report the total hours that these EMT volunteers worked during the data collection period. In this example, they have 8 part-time volunteer EMTs who worked between 15 and 20 hours a week. You can see our calculations in the gray box below. Note that the 50 hours one volunteer spent on ground ambulance vehicle maintenance are considered related to ground ambulance operations, but that the 80 hours spent by volunteers on public health outreach are considered related to all other responsibilities. Across the 8 volunteers, the total number of hours worked is 6,830, which auto-populates by summing the 2 columns to its right. Question 3 appears here because this organization indicated that they have 2 administrative volunteers, which are counted in the administration facility staff category. The paid manager is not reported in Section 7.3, which just covers volunteer labor. The 2 administrative volunteers worked a total of 1,500 hours. Our calculations for the number of hours are in the gray box. Both volunteers did not have any other activities outside ground ambulance operations, so we would enter 0 hours for number of hours related to all other responsibilities for administration facilities. Just as a note, this organization will not see question 5, which asks about volunteer medical directors, because they previously indicated that they had one paid within their organization. Finally, the last slide shows Section 7.3, Question 6, which asks about stipends, honoraria, benefits, and other compensation for ground ambulance labor. This organization provides a $5 per run incentive to volunteers and pays $100 in workers' compensation premiums each year for each volunteer, EMT. The 2 administrative volunteers receive a $500 a year stipend. You can see the calculations in the gray box. This organization would answer yes to question 6, and then input $10,800 for question 6A. This concludes our presentation on requirements for volunteer organizations. For additional information and resources, please visit the GADCS website. Thank you for your time today.